Thank you, Mr. Speaker, and I yield myself such time as I may consume.
Gentlelady is recognized.
Thank you, Mr. Speaker, and I'm here today to speak on my bill, H.R. 2576, which would save $13 billion by ensuring that Medicaid dollars go to those who are most in need. When the Affordable Care Act was passed, it created a new income formula that determines eligibility for government-subsidized health insurance. The Modified Adjusted Gross Income, or commonly known as MAGI, deviated from other federal assistance programs, failing to include Social Security benefits as income. Let me repeat that. The new income formula for Medicaid, CHIP, and exchange subsidies deviated from the eligibility requirements for other federal assistance programs. Supplemental Security Income, Supplemental Nutrition Assistance Programs, also known as food stamps, temporary assistance for needy families, and public housing all include the Social Security benefit as income. Congress didn't know that then, but we know now that the Affordable Care Act had the unintended consequence of allowing a couple with close to $60,000 in income to qualify to receive Medicaid benefits. Let me put it in more stark terms. Changing the income formula could result in individuals whose incomes are up to 400% of the federal poverty level receiving Medicaid. This is unacceptable, and I very strongly believe that it is our duty to ensure that the very scarce Medicaid resources are there for the most in need. It is incorrect to assert that this legislation unfairly targets widows, survivors, or the disabled. This is the equivalent of asserting that the public housing or the SNAP unfairly target widows, survivors, or disabled simply because, when accounting for resources, these programs consider the source of income. The health care law's deviation from the typical method of counting income results in taxpayer dollars being directed to individuals who do not meet the standard definition of low income. According to the current law, a couple who both earn Social Security benefits and have a total income of $22,000 a year would have a higher income than a couple earning $58,000 a year for the purpose of determining eligibility for federal subsidies in the exchange. I am not the only one who thinks so. At the July 14th Budget Committee hearing, I asked Richard Foster, the CMS Chief Actuary, about the income eligibility issue, and he said, and I quote, "I don't generally comment on the pros and cons of policy, but that just doesn't make sense," end quote. Foster had previously compared the MAGI glitch to allowing middle-class income Americans to qualify for food stamps. Additionally, Richard Surian, who is the HHS Assistant Secretary for Public Affairs, conceded that, I quote, "As a matter of law, some middle-income Americans may be receiving coverage through Medicaid, which is meant to serve only the neediest Americans," close quote. So, primarily, my bill is about fairness. We must accurately account for poverty in federal assistance programs. My common sense, bipartisan solution has a companion bill in the Senate, sponsored by HELP Committee Ranking Member Mike Enzi, and H.R. 2576 passed out of Ways and Means with bipartisan support. Has already been reported, President Obama himself recognizes the problem on page 41 of his recent debt reduction plan, where he explicitly proposes the entire amount of Social Security benefits be included in the definition of income. Mr. Speaker, we must bring Medicaid back into line with other federal assistance programs and limit improper payments to those who should not receive Medicare benefits. Thank you, and I reserve the balance of my time.